Hi, this is my audience.
Hi.
Did you know that in the United States, breast cancer is the most common type of cancer in women, with approximately 1 in 9 women developing the disease in their lifetime. In addition, breast cancer is the second most common cause of cancer death in women. However, men have a slightly less risk of developing breast cancer, according to the American Cancer Society. Today I will inform my audience what breast cancer is, the symptoms, and how it can be treated. According to the American Cancer Society, a woman in the United States is diagnosed with breast cancer every 3 minutes. About 700,000 women in the United States were found to have invasive breast cancer in 2013. Also, an estimated 200,000 new cases of invasive breast cancer will occur among women in the United States during 2014. Today I will be explaining how breast cancer occurs, what the symptoms are, and how it can be treated. The audience will be more informed on the subject of breast cancer. First, let's start with what breast cancer is and how it occurs. What is breast cancer and how it occurs? Breast cancer is the development of abnormal cells in the breast. These cells grow and replace normal tissue. Cancer occurs when there is an uncontrolled production or growth of damaged cells anywhere in the body. If the spread is not controlled, it can result in death. Breast cancer is caused by both internal and external factors. The first group of internal factors include family history, like having a mother or sister with breast cancer, immune conditions such as never having any children. You can have a higher risk of getting this disease. However, being pregnant at a young age lowers a woman's total number of lifetime menstrual cycles, which reduces the risk of getting breast cancer. On the second group, the external factors include tobacco. Excessive use of smoking tobacco will increase your chances of being diagnosed with breast cancer. Alcohol also is an excessive use of drinking. Alcohol will increase your chances of being diagnosed with breast cancer. Race is another factor. White women are somewhat more likely to get breast cancer than African American women, but African American women are more likely to die from cancer, according to Long Island Breast Cancer Study. There are 2 main types of breast cancer. The first type of breast cancer is called non-invasive. Cancer that has not yet developed and has the ability to spread to the rest of the breast or to the rest of the body. The second type of breast cancer is called invasive. Cancer that has the potential to spread into surrounding tissue or parts of the other body. Now that we know what breast cancer is and the factors that cause it, let's learn about the symptoms and treatment. I would like to show the audience a short video of the symptoms and treatment of breast cancer.
Cancer is the result of mutation of the genes responsible for the growth and health of the cells in the body. This abnormal proliferation may occur to the breast cells, which is called breast cancer. Breast cancer cells may continue dividing without a halt, resulting in a tumor. Breast cancer is common to women, but men are also susceptible to breast cancer. People suffering from breast cancer may not show symptoms at all, especially in its early stages. But a new lump or mass in the breast can be indicative of breast cancer. Generally, any change to the breast appearance, texture, and pain can be a sign of breast cancer. Nipple discharge or redness, breast or nipple pain, dimpling, or swelling of the breast can also be signs of breast cancer. Breast cancer has better prognosis once treated in its early stages. Thus, women are advised to undergo routine screening procedures to detect breast cancer earlier. Monthly breast self-examination, clinical breast examination, and mammography are the recommended routine screening procedures to detect breast cancer, even without obvious symptoms. Breast cancer development can be associated with a family history of breast cancer, early onset of menstruation, late menopause, dense breast tissue, exposure to carcinogens, the use of oral contraceptives, or drinking excessive alcohol. Breast cancer has various types. Some types are ductal carcinoma, lobular carcinoma, mucinous carcinoma, mixed tumors, and inflammatory breast cancer. Treatment of breast cancer is dependent on the type of cancer and its stage. Basic treatment options available to breast cancer patients are surgery, which involves the removal of the cancerous tissues, radiation therapy, that aims to destroy cancer cells by the use of high-energy rays, and chemotherapy, which treats breast cancer with medications. Consult your general practitioner whenever you notice any changes in your breast. He or she can examine you and refer you to a specialist if necessary.
Now that we know what breast cancer is,
Cancer is the result of mutation of the genes.
what some of the symptoms are, and some optional treatments, it would be best to detect it at an early stage when it hasn't spread to another part of the body yet. As we refer to the American Cancer Society, as of 2013, there were 700,000 people that have breast cancer in the United States. We definitely don't want this number to go up dramatically. Hopefully in the future, with enough research and if detected early enough, the chances of women developing breast cancer won't be 1 to 9, but hopefully 1 to 20. And it won't be every 3 minutes, but hopefully 1 every 33 minutes. Thank you.